Hello students, I am Dr. Neha Jain, Assistant Professor in Obstetrics and Gynaecology Department. In my first lecture, I have started Instruments in Obstetrics and Gynaecology, and I have completed 3 instruments: Sims Anterior Vaginal Wall Retractor, Sims Speculum and Cusco Speculum. Now I will continue with these 4 instruments. Okay. Now for general information about the instruments, please go through my first video. Okay. Now let's continue with this instrument. This is Teal's vulsellum. Okay. This is called Teal's vulsellum. Okay. Now always hold the instrument this way. Okay. The technique of holding this instrument is this way, so that the concavity of the instrument is upwards. Never hold the instrument like this, okay? Because in patient you will use it this way, okay? Now the parts of the instrument, this is jaw of the instrument which has got 3:4 tooth, okay? Now the box joint, this is box joint, this is handle, and this is catch. Catch is at 4 levels of catch. There are 4 levels in this, the 4 levels of catch. Okay. Now the technique of using this instrument. Okay. Before jumping into the technique, always remember, never ever use this instrument in pregnant uterus. Okay. Now the indication of the technique of using this instrument is after retracting the vaginal wall, anterior and posterior vaginal wall, when you are able to see the cervix, hold the anterior lip of the cervix like this, so that the concavity of the instrument is upwards. Okay, this concavity given is which matches the concavity of the vagina, and it does not hamper, the hands does not hamper the field of vision of the instrument. And if you will hold the cervix this way, this convexity will compress the urethra and may cause urethral injury, and it also causes the discomfort to the patient. So always hold cervix this way. Concavity should be upwards. Okay. Now the uses of the instrument. Okay. First is to catch hold the cervix, non-pregnant cervix. Then second, there are sometimes when you hold the uterus and give traction to the fundus of the uterus while doing abdominal hysterectomy. Okay. So these are mainly 2 indications. Now when you will catch hold the cervix. Okay, when you will catch hold the cervix, you will catch hold the cervix while doing some procedures like diagnostic procedures like endometrial biopsy, or you may require while doing cervical biopsies too, while inserting copper T, while doing hysteroscopy you have to stabilize the cervix. Okay, while doing dilatation in the curettage, while doing hysterosalpingography, you may require to stabilize and give traction to the cervix. Okay. Now, while doing vaginal hysterectomy also, you need to require to hold the cervix and to give traction. So, while doing vaginal hysterectomy also, you need to catch hold the cervix. Now, examiner may ask, what is the indication to hold the posterior lip of the cervix? You always hold the anterior lip, but there are some indication when you need to hold the posterior lip of the cervix. The posterior lip of the cervix is to be held when the anterior lip is damaged. Anterior lip of the cervix is damaged, or it is bleeding, or it has got some growth over the anterior lip of the cervix. Then you may need to hold the posterior lip of the cervix. Then while doing vaginal hysterectomy, when you open the pouch of Douglas, you need to hold the posterior lip of the cervix. Then while doing any procedure over the pouch of Douglas like culdotomy or culdocentesis, then you need to hold the posterior lip of the cervix. So these are few indications in which we need to hold the posterior lip of the cervix. Otherwise we will always hold the anterior lip of the cervix. So this is Teal's vulsellum. Okay. Always use it in gynecological purpose, never in obstetrical purpose. Okay. Now this is Rampley's sponge holding forceps. Rampley's sponge holding forceps. I have told you the non-pregnant cervix is to be held with this instrument. The pregnant cervix is to be held with this instrument. Okay. Now this is Rampley's sponge holding forceps. The method of holding is this way. Okay. Now what are the main uses of this instrument? Okay. First of all, the parts of the instrument. There are two ends of the instrument, and inner surface of these two ends are serrated. Yes, you can see the serrations both there, and fenestration. This is to provide a better grip. Okay, better grip. Then this is handle, this is box joint, and this is again catch, 4 levels of catch. Okay. Now the uses of this instrument is used to hold the sponge. Name suggests it is used to hold the sponge while doing painting, before any procedures, like in minor operations or minor procedures like property insertion, or while doing biopsies, endometrial biopsies, cervical biopsies, while doing dilatation and curettage, while doing any vaginal biopsies or any procedure over the vagina like Bartholin cyst removal or Gartner cyst removal, or any procedure over the vagina, or any abdominal procedure through the abdomen like abdominal hysterectomies or any other procedures, you need to paint the surface. Okay. So painting is done by this, and after that you drape the patient. Okay. The other use is to catch hold the cervix, the pregnant cervix. Okay. Now when you catch hold the pregnant cervix, examiner may ask, first of all start with first trimester. So while doing first trimester or second trimester MTP, you need to hold the cervix and do evacuation of the product of conception. Okay. Then after delivery, if you need to look for the cervical tears, you need to hold the cervix and to repair the cervical tear. Okay. So for looking for the cervical tear, you need two sponge holders. Okay. First sponge holder to be placed at 12 o'clock position, second sponge holder at 2 o'clock position. Okay. Then you will see any of the presence of any tear from 12 o'clock to 2 o'clock. If there are no tears, then remove the 12 o'clock position sponge holder and place it at 4 o'clock position, and then you will see the presence of tear. Look for the presence of tear from 2 o'clock position to 4 o'clock position. Then remove the 2 o'clock sponge holder and put it at 6 o'clock. Then 4 o'clock at 8 o'clock. Then like this you see for whole of the circumference of the cervix, and if there are tear, you will repair by giving traction with this sponge holder only. These are the uses. Then while inserting postpartum IUCD, you may need to stabilize the cervix and give traction, and to straighten the uterus with this sponge holder. Okay. In postpartum IUCD, there is specialized instrument known as Kelly's forceps, which is used to catch hold the copper T, and then it goes into the uterus for insertion of copper T, for proper placement of copper T. If that instrument is not available, like in peripheries, you can also insert copper T with using this sponge holder also. You just fix you just fix the copper T over the jaw of the this instrument, and then you insert it. Okay, so these are the uses of this Rampley sponge holding forceps. Now coming on to next instrument, this is Simpson's uterine sound. Simpson's uterine sound. Okay, now the method of holding this instrument is this way: pen holding position, and the curve should be upwards. This curve should be upwards. Okay, it should be pointing upwards. Now it has got parts. This is the proximal end, and this is the handle. Okay, the proximal end is bent at around 2.5 inch. Okay, 2.5 inch farther from the proximal end. It is bent and it makes 150 degree with the horizontal. 150 degree angle with the horizontal. यहाँ से 150, यहाँ से 30 degree. Okay, so the length of the instrument is around 12 inches and the working length is 9 inches. Okay, now it has got see what is uterine sounding. It is sounding means to measure the length. Okay, so to measure the length of the uterus we use uterine sound. So it has got calibrations. See, you can see for the calibrations. It is in, the calibrations are in inches. There are few instruments, there are many instruments, Simpson's uterine sound only, in which the calibrations are in centimeters. Okay, so it can be in centimeters also, it can be in inches also. So it is till here it is 9 inches. Okay, now the method of insertion of the instrument. When you have held this the cervix with the Teal's vulsellum, then you hold the uterine sound in a pen holding position, and then with very smooth gliding movement you insert it inside the uterus till you feel any resistance, and then you can measure the uterocervical length of the instrument. Okay, it is very important to remember that never ever use this instrument also in pregnant uterus. So if you are suspecting any pregnancy, or if there is confirmed pregnancy, you never use this instrument, because pregnant uterus is very soft and it may perforate the uterus. Okay, so and one more important thing about this instrument is that where there is the surface where the bend is there, you have got 3 serrations in this instrument. Okay, there are 3 serrations in this instrument, and opposite to that there is no serration. Okay, the importance is that when you will insert in see, before inserting the instrument you always have to do a bimanual examination to see that the uterus is anteverted or retroverted. Okay, if it is anteverted you will insert it this way, if it is retroverted you will insert it this way. But many a times, like in case of extra abdominal fat, okay, in obese patient, you may not appreciate the size of the uterus. In that case, the size appreciate the version of the uterus, whether it is anteverted or retroverted. In that case, you just insert it this way, that the curve is upwards, because 80% of the uterus are anteverted, and let the uterine sound decide its way, decide its direction. Okay, let it decide. And if it is retroverted, it will go like this. See, it will go like this. Now if the serration is upward, if this serration is facing upwards, then the uterus is anteverted, and if it is facing downwards, it is retroverted, because after inserting you won't be able to see the curve. Okay, so this is the use of this serration. Okay, this is the use of this serration. Okay, now what are the uses of uterine sound when you will measure the uterine length? always you will use in gynecological procedure, like in case of before inserting any copper T, before doing any dilatation and curettage or any endometrial biopsy procedure, okay, before doing hysteroscopy too, you will see the size of the uterus. Now there is also one indication when you suspect the perforation of the uterus by copper T. The copper T has been misplaced outside, and you need to see the relationship of the copper T with the uterus. Then in that case, you will insert the uterine sound inside the uterus, and then you will take a lateral X-ray of the pelvis, and then you will see for the relationship of this instrument, matlab uterine sound, with the copper T. Okay? So these are the uses of the uterine sound. Okay? The diameter of uterine sound is around 2.5 mm. So you don't need to dilate the cervix before inserting uterine sound, because 3 to 4 mm diameter, the cervix is already dilated 3 to 4 mm. Okay. Now the next instrument is Hegar's cervical dilator. Okay. This is Hegar's cervical dilator. Okay. Hold the instrument this way. Hold the instrument in pen holding position this way. Okay, so that the curve is upwards. Okay. Now these are Hegar's dilator. These come in various sizes because you need to dilate the cervix serially. So you need a smallest dilator first, then to increase the dilators gradually. Okay. Now the diameter, the number of the Hegar's dilator, like this is 3 number. So this is, the diameter is 3 mm. This is 2 number. So the diameter of the Hegar's dilator is 2 mm. Okay. So number indicates the diameter of the instrument. Okay. So you will start, you should start with 3 mm or 4 mm dilator, and then gradually 1 mm dilator, you increase the dilatation by 1 mm, and you can dilate till 1 to 1.2 mm, 1 to 1.2 centimeters, and the dilator come from 1 mm to 26 mm. Okay. So what is the method of insertion of this instrument? Always hold the instrument in pen holding position from the midpoint. Okay. And these 3 fingers should be on the perineum of the patient, so that not to overshoot. Okay. Okay. The curve should be upwards because the uterus is anteverted mostly. Then you just need to go through the cervix, go through the internal os, and just pass the internal os, not beyond that. Otherwise, you may lead to perforation of the uterus. And never apply much pressure while doing dilatation of the cervix, because it may lead to creation of false passage, or it may lead to perforation of the uterus. Okay. So this is Hegar's dilator. There are many other dilators, like the other dilator name is Pratt's dilator. It is, see, like Hegar's dilator is curved, full curved instrument. Okay, like an S. Okay, but in Pratt's dilator, it is straight from here to here. It is straight instrument, and then it has curve with tapering end. It has got rounded end, and the Pratt's dilator has got tapering end. Okay. Then there are Hank dilators. Hank dilators have cuff after a particular length of the instrument. It has got a cuff. That means a stop, so that to prevent overshoot of the instrument, so to prevent the perforation of the instrument. Okay, the perforation of the uterus. Then there are some dilators like Hawkin-Ambler dilator. In Hawkin-Ambler dilator, it is only one-ended dilator, single-ended dilator, in which the dilator is on one end, and on the other hand it has got button-like end to hold the dilator. Okay, so that has got better hold. So these are all instruments, and we'll continue with other instruments in next lecture. Thank you.